Good evening. My name is Julius Plumadore. I am the Community Advocate for the Mental Health Association of San Francisco. I'm here to represent MHASF tonight, but I'm also here as someone who's been a mental health consumer for almost the past 30 years. And first of all, I would just like to say how much I appreciate the dialogue around this issue. I appreciate that this wasn't made as a unilateral decision. I appreciate that not only do we all get to register our opinions about this, but that you're actually listening to them and that you're hearing them. That is something that marks an enormous change over the past 10 years, 20 years, and beyond that. And I wanted to thank you for your comments early on because they tie in beautifully to what I wanted to say, so thank you for that. Almost 25 years ago, I was homeless in another major city on the West Coast. And homelessness is, by its very nature, a stressful, frightening, traumatic situation. And when I was homeless, I was hungry, I was cold, I was exhausted, and I was scared. And at my lowest, most potentially volatile moment, I was fortunate that the person who responded to my crisis didn't do so with a weapon, didn't do so with the threat of force, but did so with open hands and the words, "What can I do to help you to feel safe?" Now, the person who responded to my crisis was not a police officer. He was a private citizen. I don't know what his training may have been. I don't know if he had any training. I don't know if he was simply a compassionate human being who happened to feel that that was the appropriate way to respond. I do know that I'm lucky that at that time in that place that he wasn't a police officer, because things could have gone very differently for me that day. And as you said so eloquently earlier, that having a weapon present when one is trying to make that connection, trying to de-escalate a situation, can very easily send things in the other direction. It has the potential to negate any sort of comfort, any sort of safety that the person receiving that message may otherwise have received. And I just wanted to conclude by saying that crisis, from my experience, from what I experienced almost 25 years ago, crisis intervention works, and crisis intervention training is working in San Francisco, and that's where we need to continue to allocate our resources, rather than going towards weapons that not only may be physically harmful to individuals suffering from mental health issues, dealing with mental health issues, but also can be deeply traumatic to those individuals as well. I thank you again for allowing us to engage in this dialogue. Thank you very much.
Thank you for your comments.